Demand on your care. Presentation of illness symptoms in older adults. Aging process throughout our lives. Aging is an inevitable process in life, and successful aging refers to the process where an older adult adapts to aging successfully. We often experience aging through changes in appearance, organs, and various physical functions. Let's take a look on the signs of aging at different stages throughout our lives. 25 years old. Skin. The skin gradually loses elasticity, subcutaneous fat loses support, and the ability to heal decreases. We will be more prone to wrinkles and age spots. 30 years old. Hair. The function of pigment cells gradually declines, causing hair to turn white with age. The duration of the hair growth period shortens, and hair loss increases. Muscle. Muscle density gradually decreases after the age of 30 and declines rapidly after the age of 50. It causes the older adults gradually to become weaker and slower in their movements and footsteps. Lungs. Air pollution, long-term inhalation of exhaust fumes, especially in smokers, can accelerate aging. All these factors increase the risk of chronic lung diseases in older adults. 40 years old. Vision. Vision gradually deteriorates, and the ability to focus decreases, becoming commonly known as presbyopia. As we age, seeing in dim light becomes harder, and dry eyes become common. In addition, older adults are usually susceptible to retinal degeneration and cataracts. The continuously decline in vision increases the risk of fall and inconvenience in daily life of older adults. Heart. Aging makes the heart and blood vessels stiffer, causing slower blood flow and increased blood pressure. The heart cannot pump blood as quickly or efficiently as it used to, but it still functions normally in most cases. However, thickening of arterial walls may cause arteriosclerosis, which often leads to coronary heart disease, stroke, hypertension, etc. Bone. Bone health declines with gradual loss of calcium associated with aging, especially for women after menopause, which leads to less dense bones, making them weaker and prone to fractures. 50 years old. Kidney. Kidneys tend to shrink in size as we age. This can lead to reduced renal function and impaired the urine concentration ability, resulting in excessive and frequent urination, which can increase the risk of dehydration. Men. Regarding the reproductive system, testosterone levels decrease in men, leading to decreased libido, and regarding the urinary system, prostate hyperplasia around the urethra reduces bladder capacity, gradually affecting urination function. Women. After menopause, ovarian function stops, and estrogen and progesterone decrease, causing vaginal mucosal thinning and reduced secretions, leading to discomfort and infection easily. 60 years old and above. Hearing. Older adults usually suffer from different levels of hearing impairment. They are less sensitive to high-frequency sounds, making it difficult to hear clearly. However, it's essential to consult a doctor to rule out earwax impaction as a cause of hearing loss, which is treatable. Sensory perception. The sensory perception is not as sensitive as before due to organ degeneration and functional decline. The sense of taste and smell becomes dull. The sensation of touch, pain, and temperature also decline, making the older adults susceptible to hypothermia or heat stroke caused by unbalanced body temperature regulation system. Digestive system. As age increases, the protective mechanism of the stomach weakens, making it susceptible to digestive ulcers. Also, the gastric emptying process slows down, and the secretion of gastric acid and digestive enzymes decreases, leading to poor digestion easily. Besides, the peristalsis of the intestines also decreases, causing constipation and fecal incontinence in older adults. Liver. Liver tolerance and metabolism slow down, affecting liver detoxification. Multiple medication, smoking, and drinking also burden the liver. Joints. The joints become stiffer and less flexible in aging. Joint fluid decreases and the cartilage wears down. The breakdown of the joints may lead to inflammation, pain, stiffness, and deformity, which affects the daily lives of many older adults. Neural system. Our brain decreases in size, and the number of neurons and synapses also decreases, resulting in slightly less efficient function. Cognitive changes, like slower processing and forgetfulness, may occur. However, it is essential to recognize that confusion and difficulty with problem-solving and decision-making could indicate underlying health issues, such as dementia, which requires medical attention. Immune system. The immune cells act more slowly in identifying and eliminating foreign substances like bacteria, viruses, and cancer cells. This slowdown in the immune response may explain why older individuals are more susceptible to infections such as pneumonia and influenza, which can potentially lead to fatal outcomes. In addition to physical changes, older adults may also experience certain psychological characteristics. Among them, feelings of loss and isolation are common because older adults may lose their original social roles and become disconnected from the society. As their social circle shrinks, loneliness is also a common negative feeling, especially for those who have lost their spouses or do not have children around them. Additionally, older adults may develop a sense of dependence, wanting to receive care but fearing rejection. When facing issues such as illness and death, they may also experience anxiety and insecurity. After all, aging is a normal process for everyone, regardless of their wealth, status, or background. However, this does not necessarily mean that every older adult experiences severe functional decline or inevitable chronic diseases. As our understanding of aging increases, we gradually gain insights into healthy aging. The most important is to cultivate good lifestyle habits, such as healthy eating, regular exercise, and build up social connection. Many people can still have a healthy aging process and enjoy their golden years with grace and joy. To learn more about it, let's watch our next video, 10 Tips for Healthy Aging.